it is one of the medical emergency, because the nervous system is very sensitive to any infection, very sensitive to any infection, even very simple infection, even very simple viral infection. Because if not treated and diagnosed early, if you not diagnose it early, there are fatal consequences. The patient might lose his life dead, or might finish with complication. And these complications, sometimes they are very dangerous and major complications. So we try to overview the types of infections and type of organism which affect the nervous system. So generally, the infections of the nervous system could be by many organisms, like bacterial infections. And when bacteria invade the nervous system, could lead to different type of diseases. For example, could lead to infections of the meningitis, or could affect the cerebral cortex, encephalitis. And because it's bacterial, that's why we call it suppurative encephalitis. And sometimes the infection is localized in the cerebral cortex, leading to abscess formation or a brain abscess, which is very serious. Sometimes the infection down to the spinal cord itself, perivertebral or epidural abscess. We have other organisms, other bacteria could affect the nervous system, like tuberculosis. هنتكلم عليها in detail بعدين. Or we have leprosy, neurosyphilis, diphtheria, tetanus, and so on. Viral agent, yes, could also lead to meningitis and could lead to encephalitis. And very viral encephalitis is a very serious one. Or sometimes spinal cord leading to transverse myelitis. Or sometimes very dangerous complication called progressive multifocal leukoencephalopathy, which is very fatal, viral infection. Or sometimes we have very late sequelae of viral infection called subacute sclerosing panencephalitis, and that finished with mental retardations and even blindness. Poliomyelitis, yes, rabies and HIV infections. We should not forget fungal infection, like candida meningitis, or could be brain abscess. And we face a problem sometimes. Patient admitted as meningitis and sent for investigation and given treatment as usual meningitis. But there is no response. Later on, when we receive the result, it turns that the organism which is affect the meninges is not bacterial or viral. That's why it's not responsive. It is fungal infection. Okay. We start with meningitis. Now, the meningitis as a syndrome characterized by the following. Number one, as any infection, febrile illness or fever, febrile illness. This is associated with headache and meningismus. هنتكلم شو هو المننجزمس. And طبعا this is associated with the inflammation of the subarachnoid space. Inflammation of the subarachnoid space, and this is evident by when you examine the CSF, you see the increase in the number of the cell in the CSF, phagocytosis. Now, meningismus. What is meningismus? Meningismus composed of a headache, number one, photophobia, which is very important, and nixtamines. ولهذا من تكون بالعيادة أو بالطوارئ كثير من المرضى يجوك على شكل headache. Simple questions, you ask them, did the patient have photophobia or not? So, meningismus, headache, photophobia, and neck stiffness. When you examine, there is neck stiffness. And this is accompanied by other signs of meningeal irritation as Kernick sign. راح أتكلم عليه بعدين وفي صور لها. By the way, meningismus is not specific for infection, only meningitis. Could happen by any irritation of the subarachnoid space, like in subarachnoid hemorrhage. Also give you meningismus. Now, the severity of meningitis, of the clinical feature, it varies according to the causative organism. Causative organism, whether it's bacterial or viral or something else. And also, it depends on the status of the patient himself, the health of the patient, and the presence of other complications like skin rash in certain type of meningitis. Now, this is a Kernick sign. Kernick sign. You ask the patient to lie flat on the bed. You take the pillow off. Then, what you will do, you make the hip flex. You flex the hip flexion. Then you flex the knee. You flex the knee. Then what you will do, you do leg extension of the leg. You try to extend the leg upward. And that will be accompanied by very severe pain. The extension of the knee is very painful. And sometimes it is very painful and limit the extension. ما يخليك تكمل extension كاملة. Complete extension. This is the Kernick sign, which is very important, will not take from you a long time. Like, flex the hip, flex the knee, then extend the knee. That's it. Kernick sign. The other one is the Brodzinski sign. And the same thing, you ask the patient to lie flat. Then you put your hand, palm, behind the neck and try to flex the neck. And you feel the resistance on the flexion. So you do a passive flexion of the neck. And that passive flexion of the neck, you feel the neck rigidity or resistance. And also that leads to secondary flexion of the hip and the knee. So it elicits hip and knee flexion. This is the Brodzinski sign. هذا كمان easier than that one. So these are two important signs, Kernick sign and Brodzinski sign. Okay. Now, meningitis, as we mentioned, could be caused by many organisms, bacterial, viral, and the viral are many types. Enterovirus, mumps, influenza, herpes, and so on. Rarely you could have protozoal. Okay? Protozoal, like amoeba or toxoplasma and fungal infection. Now, sometimes we have non-infective causes, sterile, especially, for example, invasion of the subarachnoid space by malignant disease, malignancy, from the brace or bronchial cancers, leukemia or lymphoma, or inflammatory disorder like SLE, like SLE. This is sterile. Now we start with the meningitis. We divide it into acute and chronic. And acute meningitis usually present within short period of time, within hours or sometimes days. And the causative organism could be bacterial or could be viral. And this should be differentiated from non-infectious etiology. They found that the morbidity and mortality of bacterial meningitis is very high, substantial, very, very high, if not diagnosed and treated early. If not diagnosed and treated early. Now, so it is very important for the prompt, quick recognitions and management of the potential cause. So it is a neurological emergency. Neurological emergency. This is for the acute one. What about the chronic one? By definition, it is longer than 4 weeks duration. For example, like the TB meningitis. And then we discuss it later. Okay. Now there are certain predisposing factors for meningitis. One of the predisposing factors is the environmental factor. Environmental factor هو the overcrowding and poverty. Why overcrowding and poverty? In there can large number of people overcrowded in a very limited space زي مخيمات اللاجئين وغيرها 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 overcrowding. And if there is somebody who got the organism, and usually the organism is carried in the nasopharynx. So the organism from the nasopharynx from that person could spread to large number of people. So overcrowding and also poverty, because poverty is associated with poor health and low immunity. Also, we have host factors, and for example, patient who has immunity problem, like immunoglobulin deficiency, patient who's immune deficient, or sickle cell disease, the patient with hemoglobinopathy, they are liable to have infections. Alcoholism, yes, another predisposing factor, because alcoholism is associated with poor health. And usually those persons who are heavily alcoholic, they have limited source of money, so they prefer to buy alcohol rather to buy food. So they have very bad nutritional status. Diabetes, as we know that diabetes is predisposed to many types of infection. Sometimes the infection could be not single organism, could be mixed etiology. And the mixed etiology usually following head injuries. Because when you have a head injury and you have open wound, that will be contaminated and multiple organisms could enter. Also sometimes called iatrogenic يعني by medical procedures. For example, lumbar puncture. Because lumbar puncture should be done in a sterile procedure. If it's not sterile, that will lead to contamination. So lumbar puncture, you have to sterile the skin at the back, complete sterilization, and of course you have the sterile lumbar puncture needles, which is disposable, and you have the sterile gloves and mask. So you do it like a major operation. Now, how bacteria goes to the subarachnoid space? It goes through two ways, either directly or indirectly. Directly from nearby structures, contagious structures. For example, infection from sinus. Okay? goes to the subarachnoid space. Or indirect from the bloodstream. هذول يسمى septicemia. So the organism in the blood and goes everywhere in the blood and goes to the brain. The causes of organism, there are many. And the causes of organism, they classified according to the age. For example, in the neonatal period, very young age, neonatal period, they found that the gram-negative bacilli is very common, like the E. coli, Haemophilus, Klebsiella, very common organism. And those organisms, they are usually sensitive to drugs like ampicillin combination of ampicillin and ceftriaxone. In children, usually the causative organism would be Haemophilus influenza, would be pneumococcus or meningococcus. هنتكلم عليها بعدين. In adult, طبعا common organism is the pneumococcus and meningococcus, and sometimes the bacterial Streptococcus pyogenes, or sometimes Staph aureus. As we said, the host factors like immune deficiency and congenital problem, AIDS, hypocyclism, and alcoholism. How is the clinical presentation of clinical features? Now, the classical clinical trials are usually the patient presented with fever, headache, and neck stiffness. And there is prodromal features before the full-blown picture of the disease. Usually the prodromal feature, which is variable according to the agent. Patient give history of respiratory tract infections or otitis media or pneumonia, and this is associated with muscular pain, headache, backache, lethargy, and tiredness. This is prodromal feature قبل لا تبدي الفول picture. Then after that, meningitic symptoms develop. And the meningitic symptoms are the following. Number one, very severe frontal and or occipital headache. Number two, stiff neck stiffness and photophobia. ولهذا يصير عندك عادة دائما انت اذا كان بالاوت بيشنت وازدحام ومرضى كثير من يجيك واحد عنده هدك تسأله سؤال ثاني اكو شيء يصير مع الهدك فاذا كان اكو شيء يصير يقدر هو يحكي لك اياه لكن don't suggest to the patient and you will ask about another symptom like photophobia. Besides the meningitic symptoms, there are systemic signs. And these systemic signs like high fever and sometimes special type of meningitis, we have a transient purpuric and petechial skin rash, especially in meningococcal meningitis. راح أتكلم عليها بعدين. These are the general symptoms. For example, we have CNS symptoms in the form of the headache and sometimes in severe cases changes of conscious level, alterness of conscious level. The eye is very important for photophobia, or sometimes phonophobia. Systemic sign, like for example high fever, sometimes seizure, and stiff neck, and sometimes irritability. هاي especially in children. الchildren ما يقدر يعبر عن حاله فلهذا تشوف الأم تشوف إنه طفلها بيختلف صار. He's irritability, sleeplessness, ما بينام, especially in children. Okay. Also aches and pains in the body and uh, it's another systemic sign. Okay. What are the meningitic signs؟ هذا حكينا عليه هو neck stiffness, Brodzinski sign, and Kernig sign. Sometimes in severe cases, especially when the diagnosis is late, there might be associated neurological signs in severe cases. شو هي هاي؟ Number one, which is very important, impairment of conscious level, focal or generalized seizures, 30%. Cranial nerve signs, about 15%. Sometimes deafness, and that deafness could be sensorineuronal type, not due to the direct infection. This is the Kernig sign. This is the Brodzinski sign. Neck stiffness. This is the same thing for children. Lie flat, then you flex the neck. You flex the neck, there is neck stiffness and flexion of the hip and the knee. The same thing, this is for the Kernig. You flex, then you extend. The Brodzinski, you flex the neck and will very limited extension. Okay. Sometime in late diagnosis, you might end with focal neurological signs like hemiparesis, dysphagia, and sometimes hemianopia. Okay. There are very serious non-neurological complications, special type, like the patient presented with shock or coagulation disorders. Coagulation disorder lead to thrombocytopenia or disseminated intravascular coagulation, DIC, or inappropriate ADH secretion and electrolyte disturbance. These are non-neurological complications. Septic complication might happen like arthritis, direct infection, or immune complex deposition, or acute bacterial endocarditis. Now, there are certain features specific to a causative organism. كل causative organism له special feature. هاي جدا مهمة جدا. تيجي كثير بالمultiple choice. For example, if we have patient with infection like the Haemophilus meningitis, what are the character? The character number one, which is very important, generally occurs in small children, young, small children. This is number one. Number two, usually preceding upper respiratory tract infection. So there is preceded upper respiratory tract infection. Number three, the onset usually sudden, abrupt, with brief prodromal features. Number four, the outcome generally good. Mortality is less than 5%. إذن هاي الكاركتر تحفظوها لأن تجي بالمالتيبل choice questions. The following are characteristic of Haemophilus influenza. ويعطيك هاي 4 ممكن يعطيك 3 صحيح ويخلي 1 غلط. Except 1. This is for Haemophilus influenza. هم ذولا يكون حكينا الهيموفيلس انفلونزا احتمال بالنيونيت واحتمال اليونج children. بالنيونيت كمان هيموفيلس انفلونزا واليونج children ايضا هيموفيلس انفلونزا. اوكي. نجي على المنينجوكوكس meningitis. This is of adult. Usually occur in epidemic مثل ما حكينا عليها. ليش؟ لأن organism is carried out in the nasopharynx. It is associated with septicemia, so it's a serious disease, more serious. associated with septicemia and can occur with arthralgia and purpuric skin rash. هاي مهمة. Now, when it is very, very severe, نسميها overwhelming confluent hemorrhages appear in the skin. ليش؟ Because of DIC. DIC. Now they found that if the onset is gradual onset has good prognosis. Like a sudden onset with septicemia has poor outcome. The mortality overall 10%. أكثر من hemophilia influenza. This is meningococcal meningitis. This is the hemorrhages under the skin. Okay. There are complications of meningococcal meningitis, septicemia, could lead to meningitis, rash, shock, DIC, renal failure, peripheral gangrene, and arthritis. They are complications. Okay. The pneumococcal meningitis, usually adult disorders, associated with poor health, debilitations, weight loss, especially associated with alcoholism. هذول خاصة especially those who are severely alcoholic خاصة بالدول بالويسترن يكونون they are living in the street in a very bad situation. طبعا the infection could be a result from secondary infection from pneumonia or middle ear infections or sinus infection or sometimes following splenectomy. The onset may be very severe, very acute, سميها explosive, very acute, and sometimes that leads to progression to death within a few hours. Within a few hours, so it's very, very severe illness. And the mortality is high, 20%. Now, poor prognostic signs if the patient presented with coma or seizure or low cell count on the CSF. هذا pneumococcal. Okay. Now, what sort of investigation? Now, if your patient is in, number one, in coma, or having on examination, having papilledema, or having a focal neurological sign, you have to exclude intracranial mass lesion with a proper CT or MRI. هذا واحد. If the patient is very ill and deteriorating rapidly or has bleeding disorders that cannot be corrected rapidly, emergency. شو تعمل؟ Take off blood for culture, CSF for culture, and you start empirical antibiotic. راح نتكلم على empirical antibiotic prior to the scan. شو هي خصائص empirical antibiotics? Now, if the above signs are absent and the CT scan exclude mass lesion, confirmed diagnosis, you do a CSF lumbar puncture to identify the normal CSF examination. Usually you do the CSF under sterile condition, and the normal, usually the color of the CSF is colorless, crystal clear, ما في color. إذا صار turbid معناه في infection. The cells are very few, less than 5, and the glucose about 40 to 80 milligram. Okay, فهي أقل من systemic serum glucose. And the protein also within a normal level between the 140 to 450 per liter. High normal values. Now, in meningitis, شو يصير CSF in meningitis? Number one, أنت بتعمل CSF, and needle of the CSF is connected to a manometer. قياس الضغط مال CSF. You find there is moderate increase in the pressure of the CSF. Okay, so there's increase in the CSF. And the color of the CSF, not clear, it's slightly turbid, but sometimes grossly purulent in severe infection. طبعا يتاخذ samples for staining, gram stain. And the gram stain could show the gram positive cocci, pneumococcus, or gram negative bacilli, the Haemophilus, or gram negative intra or extracellular cocci, meningococcus. Cell count the CSF is elevated. When normal 5, now لا يصير يمكن 100 to 10,000. Mostly polymorph or sometimes monocyte in the viral infection. CSF glucose is depressed, decreased. And the CSF protein is increased. The enzyme lactate dehydrogenase is elevated. And CSF culture, you send it, you get the result later on. Now, these are examples of CSF features. This is the normal. This is the normal example. You have the clear appearance, the pressure, the white BC protein. Now, in bacterial meningitis, the color becomes turbid. The pressure is elevated. The cell is elevated. And the protein is elevated. And the glucose is very low. Bacterial. On the other hand, in the viral meningitis, the color could be clear, the pressure could be normal, and the cells are lymphocytes, and the sugar normal. In the fungal meningitis, usually the color is clear, pressure normal or elevated, and the white BC elevated, the protein elevated, sugar normal or low. This is another example, for example, in TB meningitis. TB meningitis شوف يختلف، هاي مشابهة حكينا عليها، لكن بالتيبي meningitis إنه شوف إنه البريشر is very high، pressure is very high, and the cell count is high, monocytes, and the glucose is very, very low. Protein is very high. These are the color, turbid color, CSF. Also, we have other serological tests, which is very, very important. One of this is the polymerase chain reaction, PCR. You take a sample, شباب, take a sample to do the PCR in the CSF and the blood. This to identify the etiological agent, identify the bacterial DNA, and give you the answer of which organism is affected. This is هذا PCR هنا كل واحد ينبعث له PCR sample blood and serum. So serum and CSF give you the identical organism. Very, very important. طبعا we take a sample for a blood culture, لكن احنا we start treatment بعدين we receive the blood culture. Organism about sometimes isolated in 80% of cases, in cases of Haemophilus meningitis. The pneumococcus and meningococcus less, 50%. Also, we send for serum electrolytes because sometimes there is inappropriate antidiuretic hormone. Always look for the source of infection. Source of infection like the chest X-ray for pneumonia, skull X-ray for sinuses, sinus X-ray, sorry, and skull X-ray for if there is any fractures. اوكي، هنا هاي لازم نوقف انت نتكلم عليها in detail. Management. Once meningitis is suspected, patient should be isolated. يدخل عندك بالطوارئ مريض you suspect meningitis، دائما تعمل له isolation، توجد له غرفة لحاله. إذا ما كنت خابر الإدارة قول لهم عندي meningitis أريد isolated room حتى ما يصير spread of infection. Step number 1 هو isolation because the organism could be carried in the nasopharynx. And also هنا حكينا empirical treatment must be started immediately, often before identifications of the causative organism. What are the empirical antibiotics? Those antibiotics must penetrate the CSF and be an appropriate bactericidal dosage and be sensitive to the causative organism once identified. The initial therapy before organism identification, as we said, in the neonatal period, we can use the ampicillin ceftriaxone. In children, the ceftriaxone and vancomycin, and in adults is the ceftriaxone and vancomycin also. If the patient is immune compromised, you add with the ampicillin and vancomycin, you add the ceftriaxone. And the treatment for at least 2 weeks or 3 weeks. ما بينفع. المريض يمكن يشعر خلال أول يوم يومين is okay and you want to go home. By law, you should not go home. يبقى لازم يبقى خلص علاجه 2 or 3 weeks time. How we monitor? We observe the patient. If your patient is deteriorating in spite of antibiotics, you have to do a CT scan to exclude development of complication. شو هي هاي الكومبليكيشن؟ قد يكون hydrocephalus ليش يصير؟ يصير infections of the meningeal space and adhesion, or abscess formation, especially with bacterial infections, cerebral abscess, or subdural empyema sometimes. Then لازم تعمل CT scan to exclude. Or sometimes sinus thrombosis, فتعمل MRI benography. And we have to remove the source of infection. Chemoprophylaxis is very important لأنه especially in meningococcal meningitis, the risk is very high to the household contact. The contact مع المريض, the risk is very high. But you have to give them chemoprophylaxis in the form of rifampicin, 600 milligram twice a day for 2 to 3 days, or ciprofloxacin, chemoprophylaxis. Vaccine, yes, vaccine now change the pattern of meningitis. Meningitis are less now, especially in children, because of vaccine. It's available for Haemophilus influenza in children between 2 to 15 months. Routinely is given, or also the Haemophilus influenza, and also in children, as we said, against Haemophilus influenza. Between the age of 1 to 18 years, we give against Neisseria meningitis. In adult age 60 and elderly, تقريبا streptococcal pneumonia. وهذا صار روتيني الآن، especially هذول مثلا يروحون للعمرة أو للحج لازم ياخذون immunization because overcrowding. Steroid. طبعا the benefit of steroid is not certain, less certain. But if patient is critically ill, shock, hypovolemic, تستعمل intensive course supportive therapy could be required. لكن دائما ما بنعطي، نعطي فقط ال critically ill. اوكي، اذا هذا ال usual infection organism. What about the TB meningitis? Now this is the commonest manifestation of TB meningitis in children. TB meningitis usually results from the bacteremia following the initial phase of primary pulmonary tuberculosis. An adult could occur many years after the primary infection, reactivation. And the clinical features of tuberculous meningitis is due to the following. Number one, because of infection, and the infection causes exudation and lead to obstruction of the CSF flow, especially at the basal cisterna, and this results in hydrocephalus. Also, another presentation is vasculitis, inflammation around the blood vessels, and that leads to infarction of the brain or spinal cord. They found that the basal meninges are generally more affected. Now, for the clinical features, now the majority of the patients are now adult. لأنه childhood TB now is now rare because of immunization. انقسم إلى stages. In stage 1, when there is non-specific prodromal symptoms over 2 to 6 weeks. And these stage 1 prodromal symptoms, like for example, fever or lethargy, sometimes presented as a fever of unknown origin, PO, مدة 6 weeks. ما حد يعرف عنها. prodromal feature early. لكن stage 2 وهو intermediate, the patient passes into confusion and cranial nerve paralysis, meningismus and vasculitis, hemiparesis, quadriparesis, and so on. Stage 3, very advanced, lead to coma. The complications are many, like seizure, occur at the onset, involuntary movement, and atypically the illness may develop very slowly over months sometimes. This is atypical, not typical, atypical. It presented over a very long period of time in months, presenting with dementia. But could be presentation very rapid, like pyogenic bacterial meningitis. Occasionally, the cerebral feature is more and more prevail rather than sign of meningitis. But if untreated, patient missed, the illness may progress from phase 1 to death in 3 weeks' time. Complication of adhesion, arachnoiditis, and inflammatory oxidation, leading to hydrocephalus, dementia, and blindness. Investigation, طبعا you have general investigation like anemia, leukocytosis, hyponatremia. CSF examination, you find that the cells are lymphocytes. Cells are lymphocytes present in the acute phase, but in the acute phase we have polymorph. The protein is very high, very, very high, and the glucose is very, very low. طبعا microscopical examination and staining by the Zeal-Nielsen to identify the acid-fast bacilli in 20% of patients. We sent for CSF cultures, but that take a long time, it was 6 weeks to confirm the diagnosis. Like, and if we suspect, we start before confirming the culture. طبعا PCR is important to identify the bacterial DNA. Other investigation, we do chest X-ray to identify changes in the recent or old TB. طبعا CT أيضا for meningeal enhancement. How we diagnose? We diagnose the presentation with the characteristic features, and sometimes the staining. Sometimes the staining is negative. Don't wait until the result of the culture, starting the anti-TB treatment. So the TB is one of come in the differential diagnosis of subacute of chronic meningitis. هاي النقاط الأربعة مهمة بالdiagnosis of chronic meningitis. تتضمن الفيرال meningoencephalitis with normal CSF sugar, carcinomatous meningitis, partially treated meningitis, and fungal meningitis. A differential diagnosis of subacute or chronic meningitis. Now, if you suspect the cases, you start with the anti-tuberculous treatment. تطلب anti-tuberculous treatment والrecommended feature program هو normal regime. You start with the first 2 months, you give the INH, you give with vitamin B6 to prevent polyneuropathy, plus rifampicin, pyrazinamide, and septamycin. راح تاخذون التي بي ان شاء الله تاخذون هذا الدرس. هذا in the first 2 months. بعدين بين 7 to 12 months you add بالإضافة إلى الآيون rifampicin تستمر عليه. In resistant cases يضيف أميكاسين. هاي مطلوب موجودة بس ما مطلوبة منكم اللي راح تاخذوها بالتي بي بالميديسن. نجي على steroid therapy. They found that many doctors, many clinicians combine TB therapy with steroid. Why? They hope that this will minimize the risk of obstructive and arthritis and arachnoiditis, prevent adhesion. فكثير من الأطباء يضيفون تي بي الستيرويد مع الانتي تي بي. لكن طبعا benefit are uncertain. لكن steroid definitely recommended if the patient having deteriorating level of consciousness, progressive neurological sign, and evidence of spinal block. هذا التي بي meningitis. بعض الأحيان يصير infection localized like brain abscess يسموها brain tuberculoma. The brain tuberculoma occur in cerebral hemisphere or cerebellum or brain stem with or without tuberculous meningitis. But it produces a space-occupying effect, space-occupying lesion. The lesion may be single or multiple. طبعا CT and MRI demonstrate the lesion. Well, it's very responsive to anti-TB. This is the scan, and these are the tuberculoma. Okay. باقي لنا فقط الفيرال انفكشن، والفيرال انفكشن هو meningitis or encephalitis. بالفيرال meningitis presentation with headache, fever, and neck stiffness. لكن the patient may do not appear as ill as those with bacterial meningitis. so it's milder than bacterial meningitis. Also, it's associated with systemic viral infection like skin rash, lymphadenopathy, pleurisy, carditis, organomegaly. And طبعا التريتمنت هو cyclovir, antiviral. On the other hand, the viral encephalitis, more serious illness, lead to the alteration of conscious level and coma, lead to seizures or focal neurological signs, or sometimes present in patient acute confusion state. وكثير من المرضى young patient يجون acute confusion state and difficult to control. طبعا التريتمنت هو supportive treatment and intensive care plus acyclovir. Finally, we have special type of viral infection, the herpes simplex encephalitis, type 1. And that causes fatal encephalitis, characterized by headache, neck stiffness, vomiting, and behavior disorders. Sometimes the memory loss, hemiparesis, focal or generalized epilepsy. This is the herpes simplex. Very fatal disease. And rapid progressive over several days to coma or death. Like in those who survive, they are left with memory loss or behavior changes. The CSF examination, there is increase in the lymphocytes and pressure. طبعا التريتمنت protein also elevated. هو التريتمنت admission to intensive care and acyclovir and supportive therapy. Finally, the causes of chronic meningitis نرجع مرة ثانية هو الانفكشن like partially treated bacterial meningitis, TB meningitis, Lyme, and others. Non-infectious like neoplastic or connective tissue. That's it. Thank you. موضوع طويل.